Hello everybody, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about a very interesting topic, and that is palmistry. People run to astrologers and palmists because they want to know about their future and what life holds for them. But if you are an expert palmist, it is not just your palm that the man is looking at. He is also looking at your general demeanor. He will tell you that you won't live long if you are fat and obese and obviously unfit. And if you are unkempt and dirty and badly dressed, he will also begin to suspect that you have some sort of mental illness. But it took the medical fraternity many years before they realized that a lot can be learnt about a person by looking at the palms. First of all, everybody's hands have typical whorls and loops on the fingertips. These whorls and loops are characteristic and typical for every individual, and no two people have identical fingerprints, not even twins. This is one of the oldest methods used to solve crimes. The other thing is that if you open out the palm, you will find that there are creases. These creases are formed during the 12th week in utero. That means when the baby is 3 months old, it holds its hands tightly clenched and these creases are formed. At that time, if the mother has an illness or a physical injury or she takes medicines, the way the baby clenches the hand is affected and the creases are changed. After the child is born, if you see that the fingers should all be of different lengths, but if the ring finger, the middle finger and the forefinger are of the same length, then you have to look for other abnormalities in the child. This may be because of thyroid diseases or chromosomal abnormalities. If you open out the hand of a newly born child, there should be 3 lines or palmar creases, but some people have only 2. The first is a straight line going all the way across the palm, and this is called a simian crease. It may be present in one hand or in both hands. It may be congenital, with one or the other parent having a similar crease in only one hand in one of the palms. But it is associated with many chromosomal abnormalities like the trisomy 21, 18 and 3, and this is Down syndrome. Also it is associated with renal diseases. So if you see a child with a simian crease, it is important to check them for other abnormalities. Also, they have a 50% chance of developing leukemia later on in life. People who are going to develop tuberculosis or leprosy also have abnormal palmar creases, but the abnormal crease is found near the thumb. How do you know what a person is going to be when they grow up? If the forefinger is actually longer than the ring finger, that means they have been exposed to testosterone in the uterus. These people are likely to become scientists and have physically challenging jobs, whereas those whose ring fingers are longer than the forefingers are more likely to be artistic. This is true in both males and in females. If the hands are yellow in color, it may be because the adult is jaundiced, or it may be because they eat a lot of carrots and papaya, producing a condition called carotenemia, where the palms are stained yellow in color. If you look at the fingernails, people who have lung diseases have curved fingernails looking like that of a parrot's beak, and if it is, sometimes it is present only in 1 or 2 fingers and only on one hand, then you have to carefully check the person for lung abnormalities and lung cancer. Looking at the way a person walks and holds their palm when they walk is very important. A person who is fat, obese and has a BMI more than 30 will walk with the thumbs facing backwards and the palm facing backwards. A person who is of normal weight will hold the hand straight ahead so that the thumb faces forwards, and a person who is underweight will walk with the palms facing outwards. So with a little attention to detail and looking at the hands of the person, you too can become an expert palmist. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you liked what you heard, please subscribe to my channel and press the bell button. If you have any other topics you would like me to cover, please write into the channel. The same content is available in Tamil. Thank you.